Is Australian private health insurance really worth the money? The short answer is no. The long answer is maybe, under certain circumstances. Australia's universal healthcare system means a person can go through life without private health insurance. Indeed, some people do this by choice, but these people are usually in a position to cover out-of-pocket medical expenses. A lot more people go without private health insurance because they have no choice. They are not in a position to pay for it. There is much wrong with private health insurance in Australia: junk policies, complicated rebates, ever-increasing premiums, shady deals with private hospitals, inconsistent payouts for procedures depending on the hospital and/or doctor, to name a few. And to top it all off, despite being private insurance, the government still tips in a 30% rebate on premiums. Most people really only have it for ambulance cover, and the ancillary cover for things such as optical, dental and physio. So it really depends on the individual's circumstances and how healthy they and their family are as to whether it is value for money in the long term. My feeling is that it is not. It totally depends on your circumstances. Me and my family have health insurance. We pay approximately $300 PM for it. Do we use it? No. Is it worthwhile for the product we get? No. Do we have it because the insurance companies are so far up the asses of the government that they push shit through their eyeballs? Yes. The Medicare levy, the most ridiculous, unfair taxation rule in the history of ridiculous, unfair taxation rules, ensures that private health insurance is essential if you are earning any more than 16 peanuts a day. To be more serious, if you earn any form of an okay wage, the government will tax you a Medicare levy at the end of the year. You can either choose to pay this levy, or you can get health insurance. For us, getting health insurance is expensive, but it is cheaper than the Medicare levy. It is hidden under the guise of, well, if you have health insurance, you will put less pressure on the public system. Which is a load of bollocks, because even with a high level of health insurance, 99% of my family's health transactions are still through the public system. This is not an active choice, but just how it works. Even if you want to see a private specialist, you pretty much have to go through the public system first anyway. And most of the time, the private specialists split between private and public anyway, so if you're not in a huge rush to get the procedure done, you can save your excess by waiting to see them publicly. It's a ridiculous taxation rule to further strengthen the billions of profit that the not-for-profit, health insurance companies drag in every year. So next time you are in Bali, and you grumble about the corruption of the police officer that asked for $10 instead of the speeding ticket, perhaps you should congratulate them on their honesty. At least they don't hide their corruption behind taxation laws. Yes, sometimes it is worth it. My husband has top private health cover. He has Parkinson's and it helped to pay for his DBS surgery. I do not have private hospital health insurance as I cannot really afford it. But I do have basic extras cover for dental, etc. Which is definitely worth having, as I have found out, and it costs $27.50 per month. When you get older and may need a joint replacement such as hip or knee surgery, there is a long waiting list on the public hospital system for those types of surgeries. If you are in pain, you may have a long wait before you are able to have the operation. But with private hospital cover, you can have it done ASAP generally. So it is worth having private cover in that instance. I had breast cancer and was treated under the public system. I have no complaints as the entire care I received was wonderful.